Good morning friends. In our previous video of basic surgical instrument part 1, we have discussed about the identification of instrument and various surgical uses of the instrument. In our part 2 video today, we will discuss about medical and paramedical students have to face practical examination, surgical viva, methods of facing, and which are the leading questions examiner will ask and how to reply successfully these questions and getting the maximum marks in the surgical viva table. So today we will discuss about the part 2 video. Now whenever you have to go for the practical viva instrument table, you have to go confidently, enter the table, greet the examiner, good morning sir or good afternoon sir, in this manner. Now examiner will ask 5 to 6 questions to you to get the information what you are knowing and how you replying the answer successfully. That will give the credit or scoring to you. So suppose I am a student and I am facing the practical examination. I will enter the table and examiner will give me one instrument, or examiner will ask me to lift any one instrument. Then I will hold any instrument. At that time, do not play the instrument. You have to reply. Examiner wants 5 to 6 questions. Number 1, identification instrument. How? Number 2 question, how to hold the instrument. What are the parts of the instrument? That is the question number 3. Question number 4, what are the uses, surgical uses of the instrument? And question number 5, how will you sterilize the instrument? And question number 6, what are the principles of sterilization or the autoclave? And question number 7, what are the advantages of the autoclave? So when you are going thoroughly or answering properly, you have to face all the question, and if you reply all the question successfully, then you will score maximum or the good score. So suppose examiner will have given me this instrument. I am a student, so I will reply, good morning sir, this instrument is a Spencer Wells hemostatic forceps. Now I have holded this instrument 4 finger. So the method, without replying any question, you have already replied the second question. So this type of instrument, suppose Babcock forceps, needle holder, Ellis, artery, mosquito or scissor, this all the 4 instruments, 5 instruments, you have to hold 4 finger grip. Index finger will stabilize the instrument, thumb and ring finger will enter into the finger bow, and middle finger will support. So that is the 4 finger grip. Suppose this instrument you have to hold with the pen grip method. That is the pen grip method. So that will be the answer of the second question. Any type of forceps, tooth forceps, plain forceps or Edson forceps, that should be holded with the pen grip. So there are 2 types of the grip. So my second question's answer will be the grip. How will you hold? So if this instrument you will be holding with the 4 finger. If this instrument or forceps you have to hold with the pen grip. Now third question's answer, that is the what are the parts of the instrument. So I will describe parts of the instrument. Blade, box type of the joint, handle, finger bow and catches. Now in this type, box type of joint, suppose this is a scissor. In this instrument, this is a simple type of the joint. Examiner will ask what are the advantage of the box type of joint. So that will give the stability to the instrument. So that are the reply regarding the parts of the instrument. Suppose this is a Langenbeck forceps. So you have to hold in this manner. This is a blade, handle and catches for this fenestra. So how you are holding, so that will be the question number 2, and description of the part, that is the question number 3. Suppose then examiner will, what are the uses of this instrument? Suppose you have given this instrument. So I will reply, this is a Babcock soft tissue holding forceps. So I have to reply, what are the uses? With this forceps, I will use hold soft hollow tubular structures during the abdominal surgery. Like I can hold with this forceps stomach, small intestine, colon, appendix, fallopian tube. So this will, while holding with this instrument, this will not injure the tissue. So the purpose of uses of this instrument, a traumatic forceps, it will not injure the tissue whatever we are holding. Suppose Alice forceps, this forceps I will hold the tough structure like skin, fascia. Purpose of is this instrument, firm grip that will cause the trauma whichever the tissue we are holding. So we have replied the three questions: identification of instrument, method of holding, and what are the uses of the instrument and what are the parts. So we have replied the four questions. If you are giving properly all the four questions during the Viva, then examiner will proceed for the fifth question. How will you sterilize this instrument, stainless steel instrument? So I have to give reply, sir, I will sterilize this instrument with the autoclaving. Then examiner will ask another question. What are the principles of the autoclave? Sir, principles of the autoclaving are at instruments are boiled at higher temperature with the special instrument, that is the autoclave. In the principle, that is a high degree temperature 120 degree at 15 pound pressure, 15 lbs pressure for 30 minutes, that will destroy all the microorganisms like bacteria, virus, parasite and fungi, and all the spores are destroyed. That is the advantage. That was the sixth question. Suppose you have all the replied all the questions successfully. Now examiner will proceed, because you have been allotted 10 minutes. Then examiner will ask about the consumables like Ryle's tube, Foley's catheter, syringe, needle, tracheostomy tube, whichever. Then if you have replied properly, then examiner will ask about the X-ray. So you have to go fast. So that is the method of proper scoring. I think this video will help all the medical students and paramedical students who are facing the surgery practical Viva, how to go get the maximum scoring during the Viva. If you feel need further information, you can follow our further video also, and you can also ask me in the comment. I will be pleasure. It will be my pleasure to reply your answer properly. Our next video will be for the basic consumables like Ryle's tube, Foley's tube in our next video. So follow and subscribe our channel. In the next video, we will give information regarding the consumables. In then another video, we will give information about the suture material and various types of the needle. Thank you very much for watching my video.